Health Youth Town Hall, Stopping the Stigma. Sponsored by Lindner Center of Hope, Central Clinic Behavioral Health, New Path Child and Family Solutions, Glenwood Behavioral Health, Community Health Alliance, and Interact for Health.
And good morning, everybody. Welcome to What's Happening in Health. If we look a little different today, it is because we have some great people in the house for our Youth Mental Health Town Hall. So excited to have them here today. Can't think of a better subject to be talking about. The CDC does report that as many as 1 in 3 young people between the ages of 12 and 17 have a mental health problem. Those include feelings of anxiety, depression, sadness, hopelessness, and nearly 1 in 10 will consider taking their own lives. So look at this, quite the team today. Give me a quick wave there. We are so glad to have you in the house. They are here to help us turn this trend around. We are focusing today on stopping the stigma. It is often associated, we know, with a mental health problem. They also will help provide many resources aimed at saving lives in our community, and we will meet them one-on-one throughout the hour. But first, we do want to start today with a wonderful team surrounding me. Hey, good to have you guys here. So glad I said hey because they're with the Hey program. It's actually something new that you might not have heard about with Interact for Health. So let's start right over here. Give me your first name.
RT.
RT. Tell me a little bit about the Hey program. Why'd you get involved with it? What do you love about it?
Mental health is important. I think it's one of the things that got me first started with it, seeing it within my own family, in my own community, seeing the struggles that we've gone through together, and how I can help in my own community and the greater Cincinnati area.
All right, you don't get to drop that on us and not say, hey, it's in my own family. What's in the family? What have you learned?
Just a lot of struggle with a lot of outside factors, external factors, things with work, relationships, things of that nature that just are hard to navigate, especially in the climate of the world today.
Boy, that is so true. And you know, all of us humbly have that in our families in some way. First name?
Delaney.
Delaney, what made you sort of gravitate toward the Hey program?
I chose to be a part of Hey because I was struggling with my own mental health, and I wanted to make the mental health conversation less stigmatized, and I felt the best way to do that was to be a part of the conversation.
So let's talk about that. How's it going?
It's been good. I am very proud of the stuff that we've been doing, just trying to get more resources available to other youth.
What do you find yourself sharing with them that you've learned that helps you stop the stigma?
That you're not alone. Just that there are support systems, and that you have to find them and you have to ask, but that they're there for you.
Yeah. It's interesting when you start looking for help and resources. We do have a lot, and that's one of the reasons we're here today. Godspeed. I know his first name. How about you? Tell me about your program.
I've been a part of Hey since the fellowship first started, and I've learned a lot about just making sure
Making sure that you can really speak about mental health in a way that it usually doesn't come up. Huh?
Yeah, like I've learned about how to spread different ways we can spread and talk about mental health in areas that look down or stigmatize it more than other areas and stuff like that. So
well, when people just ask you, hey, what did you do for the summer, or why were you in this program, doesn't that invite a different conversation?
Yeah, it lets people know about what's been changing in their community that they may not have paid attention to or noticed. So it brings, and then they can spread it with their friends or family, so they can bring more awareness to it. So that's cool.
Yeah, excellent, good job. All right, well, we have you here because they all just were bragging on you. What's the Hey program? Tell us who you are.
So I'm Marina Hopkins. I'm the new executive director for Hey, and Hey stands for Hopeful Empowered Youth. And it's a passion of mine to be able to help address the mental well-being and health of our youth in our greater Cincinnati area.
So you shared with us a few photos and some video of this program. Let's talk about what is it, how does it work, how can people connect with you, that kind of thing.
So Hey Cincinnati is comprised, we serve as a backbone, so we're comprised of over 200 different partners and stakeholders who have come together across greater Cincinnati and northern Kentucky to rally around different issues and concerns that the youth fellows have brought up in the community. So we work. We have partners from treatment, we have partners from caregivers and community, and then we also have a schools team. You can check us out on our website and get all the other information there. As far as our youth fellows, we have about 24 youth fellows that will be starting, have started actually this month, from different schools in the area, and they meet every Monday evening in partnership with Youth at the Center, and they come together and they rally and they talk and they develop and they advocate and they post on social media things that are going on in the community and how to continue to address things when it comes to our mental health.
And you say at the center, so that means where?
Youth at the Center.
Youth at the Center.
Youth at the Center is another organization that partners with us that's located right off of Reading Road. So we collaborate and use their facility.
Excellent. Okay, so she said you guys have sort of learned everything from new coping skills to ways to communicate. Let me give you a word. If somebody comes to you, one of your peers, and says, I have anxiety, what do you ask them?
I think the first thing that I do is I sit with them. I think that I allow them to explain to them what is causing anxiety. Is there anything that I can do as a friend to help? And if not, what resources can we find you to find that help that you need? Anxiety is something that we all have felt, depending on how large or small that feeling is. We all do feel anxious at times, and it's important to normalize that feeling and validate, but to also then look to help and encourage to find help as well.
Has that been well received?
I think so. I think one thing is it can be uncomfortable for a lot of us, especially at the younger ages. It can be hard to grapple with those type of challenges, but I think it's important to, like I said, normalize and encourage. And that's been something that is well received, feeling empowered and encouraged no matter how you're feeling.
So you know what I heard him say? That you listen. Did this program help you learn about listening to others?
Yes, it has. I have definitely learned to be more intentional when listening to other people. It's something that I think you always are working on, is learning to listen to others. But being a part of HEY, it's always about the intentionality behind everything. So everything I feel we do is intentional. So when we're listening to others share their story, we want to hear them and understand them and know where they're coming from, so we can provide resources for the things that they've been through, because they're not the only person that's been through that.
You know, that's one of the things that we learn in news, that we don't have the answers, but we usually can find someone that might have them for you. So you heard them say they learned to listen, and one of the things that I know people often bring up with mental health are some serious subjects. They might be thinking about, you know, they're feeling depressed, they're feeling suicidal. So how do you direct them? What did this program teach you about getting someone to the right place?
We were able to talk about and learn about a lot of resources, like they stated before, that we can help to reach out, or people around the community that they feel comfortable with, that can help them with whatever they're dealing with. And some of the people at the fellowship have also been trained in a little bit of QPR. So so if they ever feel like they need to talk to anybody, if they can't find any resources instantly, they can also come to some of us who are a little bit trained in QPR, which would be helpful for anybody who's struggling with any of this stuff.
So since he brought up acronyms in news, we have to define those. Let's turn to your team. QPR stands for?
Question.
Persuade.
Persuade and respond, I think.
Is that right?
That's news to me.
So they're learning stuff you don't even know.
Correct.
Yeah. It is question, persuade, respond.
Yeah.
And one of the things that's so important is it sort of says, hey, I know something's not okay. And so you're sort of allowed to question, whereas normally you'd be like, oh no, should I talk about that? Yeah. So when you hear this conversation, then what are you seeing? How are we elevating this conversation to stop the stigma? What are you providing them so they do have resources to take to others?
So the youth fellows, HEY really focus on keeping the youth voice at the center and it really being a youth-led initiative. And so we really rely on them to guide and give us the voice and give us the directions. And our 10-year strategy is all built on things that they have said. So wanting a sense of belonging and wanting a sense of community. So we really, with our stakeholders and partners and in our different working groups and how we're structured, we make sure that the youth voice and their response is center and present, so that as adults are making decisions about how to come up with solutions and tools, that their voice and their ideas, that they're at the beginning of the conversation and not at the end.
Excellent. Well said. That is why we are here today as well. So we want to make sure, if you'd like more information about this group, they're part of something called Interact for Health. We've had the privilege of working with you throughout the years. But Interact for Health has an address on Montgomery Road. We have a phone number for you there. We have an email. We'll be putting, of course, all of this at what'shappeninginhealth.com. Stand by, because we're going to be coming back with you guys as part of the panel. But we do want to tell you what's coming up. So just ahead, the Community Health Alliance providing mental health services in our area as well. They have addiction recovery and much more. So let's go meet Rebecca Dickerscheid. Hi, Rebecca. We're going to talk to her next. She's the executive director there, and you are watching the Local 12 Mental Health Town Hall. Welcome back, everybody, to our Youth Mental Health Town Hall. If we look a little differently this Sunday morning, it's because we are talking to resources in our community. We want to meet Rebecca now. She is with
Community Health Alliance.
And what is the Community Health Alliance?
Community Health Alliance is a parent company for Sojourner Recovery Services and Transitional Living. Sojourner Recovery Services provides substance use services, where Transitional Living provides our mental health services. And I'm the executive director at Sojourner Recovery Services.
Okay, so we had the privilege of getting just a little video of, where you are, kind of that building and whatnot. But
yes.
In that, you have just a host of resources.
We
Talk
do.
to me a little bit about that. Who comes to you? How do you serve them?
Yes, so with comprehensive services, we run from residential all the way to outpatient services. So anybody that's seeking services is able to either come from our website, to our website, or call our phone number, and we are able to provide services depending on what they need. So if they're calling and they're asking, they're saying they have anxiety, then we're able to recommend what level of service they need based on that.
So I think one of the things that we wanted to make sure people know is that we consider addiction part of the mental health spectrum.
Yes.
And I know not everybody sees it that way, and I know you work with some of that in your community. Talk to me a little bit about that.
So these conditions are often co-occurring, and so especially with youth, they really run the gamut, right? So if they have a substance use concern, they may also have a co-occurring mental health disorder, or vice versa. So we're able to provide with that sister agency that we have what's best for that client.
So one of the things that we often do say is we start self-medicating because of what we're feeling. So when you share that with a young person, does the light bulb sort of come on like, oh yes, I did sort of have that experience?
Yes. Often you find it starts out small, so it may be at a party or here or there, and so it gives them the opportunity to really say, hey, wait, how can I take care of this in a healthier way?
And part of the reason I bring that up is, we're talking youth, and you'd think, oh, that's not even in that age group, but they'll tell you they start struggling very young.
Yes,
Yeah,
yes.
quite often. What do you feel like you find yourself wanting people most to know about your organization?
So we are actually a national provider of 988, and 988 is the Suicide and Crisis Lifeline. So we are one center out of 19 in Ohio. We serve Warren, Clinton, Preble, Montgomery, and Butler County. So if you are experiencing emotional distress and you call that phone number and you're in that service area, you're going to reach one of my staff members that's going to help you work through whatever crisis you have, whether it be big or whether it be small.
And that's really important, because I know in some communities across the country, we haven't had enough resources. But
Yes.
here, I'm told they will find you the person you need.
Yes, they have a comprehensive network, and so one of the best parts about it is that we have national backups, and then we have our partner agencies. So if we're not able to figure out what that resource is, the national backup or our other agencies we can reach out to and find whatever help that person needs.
Yeah, no question. That's the reoccurring theme. If you don't know, we will find you that
Yes.
resource. Stand by. Going to have you come back with the panel, but if you do want to find out more about the Community Health Alliance, we are making making sure we have addresses and phone numbers with each person that you meet today, and all of these details at what'shappeninginhealth.com. Great job. Thank you. Stand by. We'll be coming right back. But just ahead, the Lindner Center of Hope has worked with both youth and adults throughout several years in our community, inpatient, outpatient care. So coming up, we're going to meet Dr. Tracy Cummings. She is the Chief of Child and Adolescent Psychiatry at the Lindner Center of Hope. Stay with us on our Youth Mental Health Town Hall. Welcome back, everybody. We are sharing something really important in our community today. We are focusing on youth and mental health. So throughout the hour, you're going to meet resources here. Normally, we'd be sharing health information, but we can't think of a more important subject going on right now than taking care of our young people. Tell us a little bit about you.
Sure. My name is Tracy Cummings. I'm a child and adolescent psychiatrist, and I work at the Lindner Center of Hope in Mason.
So we've had the privilege of sort of getting to know your team. I know initially when people were in Children's Hospital, they sort of had nowhere to even transition to get the kind of care you provide, but you've since expanded. Tell me just a little bit about your services, what you offer, that kind of thing.
Sure. Lindner Center is a freestanding mental health care facility, and we really serve people from 2 to any age. And then we do that in lots of ways with different modalities for different diagnoses and even different levels of care. So that for youth may look like an outpatient appointment that helps their pediatrician make decisions. It may include individual or group psychotherapies. It might be med management. It might be neuropsychological testing. It might be our neuromodulation unit, which has TMS and ECT with certain age parameters for the youth. But we also serve a summer skills program where we do 12 to 18-year-olds, and then our partial hospitalization program also for the same age.
And I know we have a little video. We were just up on your campus recently. I know you serve inpatient, outpatient. You're also expanding.
Yes.
And it sounds like the model is moving now that you're trying to provide more resources so you don't always have to get your care inside the hospital.
It's true. I think because we have so many experts under one roof with different interests, we can really meet people where they are on their mental health journey, and we're serving an entire family from the youngest to the oldest, and that might be telehealth, it may be in person, it just kind of depends on what they need.
So let's talk about that, because I think one of the most important things we could let people know in this hour is that one size does not fit all.
Yes.
So when you evaluate, I know you can do everything now from, unique testing for what medications to take to, group programs to individual. How do you do that evaluation?
Well, we usually try to come at it as a team, and then that allows us to divide and conquer. We also want to hear the voices of the youth that we're serving. We want to hear the voices of the caregivers. If we can include important people in their lives like teachers, coaches, those that can provide us with other information about how to best serve them, we take the time to really do that.
So final thing, I know one area that I've had to sort of say, I know you have a resource in this, sadly, is now through social media addiction and some of the things that influence a young person's time. Just tell me how you work with that.
It's individualized because we know it depends on how much time someone spends on the internet. We know it depends on what kind of content they're looking at on the internet and that particular child. But it may be problematic use all the way up to addictive behavior. And that, again, is going to require a comprehensive assessment. We have therapies to help with that. We have some group programming that's coming down the way to specifically look at electronic and social media use, and even med management if it's required for someone.
It is so interesting that a few years ago we might not have even been talking about something like that. But stand by, we're going to continue this conversation. We just want to make sure we knew we have resources for just about anything that a young person might struggle with, or wherever you are in this journey. You can find the Lindner Center of Hope there on Western Row Road, the phone number there as well. And again, all of this information on our website at what'shappeninginhealth.com. Dr. Cummings, thank you. Stand by. We'll be coming back shortly. All right, just ahead, they provide outpatient mental health services and some of it right in your own home. We're going to meet the team from New Path Child and Family Solutions. Eric Cummins, New Path CEO, and Joe is here, the Chief Medical Officer. So glad to have you guys in-house. We're going to meet them next on our Mental Health Town Hall. Welcome back, everybody. You're watching our Local 12 News Youth and Mental Health Town Hall, a really important subject, which is why we sort of have a takeover on our What's Happening in Health program today. We're joined by some people in our community that have been here a long time. Tell us who you are and what you do.
Yeah, Eric Cummins from New Path Child and Family Solutions, formerly St. Joseph Orphanage. We've been serving kids and families in the Cincinnati region since 1829.
So you sort of shifted the model recently. Just tell me a little bit about that.
Yeah, there haven't been orphanages in the U.S. since the 70s and all that, but we became a mental health, residential, and foster care program back in the late 70s, early 80s, and we serve kids in 8 or 10 counties throughout Southwest Ohio.
So when did that transition take place?
Became a mental health center in like 1989.
And so the resources have continued.
They are. We provide services in homes, so the families are the experts, so we go in and help them through the trauma, the mental health, whatever they're going through to meet them where they're at.
Which is why we have, I call them Joe, but tell us who you are.
Joe Riemann, I'm the Chief Medical Officer at New Path Child and Family Solutions.
So one of the reasons I'm so glad you're here is that one thing I think is really helpful is you address the health of the whole body when you address the mental health.
Absolutely.
Tell me about that.
So yes, we like to do a full evaluation, not just on the individual and not just based on a diagnosis, but we look at the entire family, the entire environment. That's part of the reason we want to have people not only go to the home, but we actually have staff that go into the school because our children are spending a lot of time in school and it's a big source of stress. So like he said, we want to meet kids where they are and we want to address the problems where they occur.
All right, so we got a little video, just kind of outside stuff, but when I hear you say that, one of the things that parents will always say, and even kids, is getting a diagnosis is sometimes a relief. Maybe I really do have ADHD, or maybe I do have a thyroid condition that influences my being overweight, which makes me bullied. Tell me a little bit about the process of really kind of getting to the core of some of those things.
Yeah, I know it's been mentioned before, but it's a team approach. So we do like to have assessments from licensed therapists, and a big thing that we offer is called open access. So we have days and times that you can just walk in without an appointment and have a full assessment done and access services that day. And then we'll obtain information from outside sources, parents, coaches, teachers, all of those sorts of things, and you can leave with a provisional diagnosis that day.
Wow, what a great concept. And, you know, I think we never had walk-in mental health care. That's sort of a newer concept. Tell me why you did that.
Well, you know, I'm a clinician by training, and back in the day, somebody would call and it'd be like, oh, okay, I'll see, you're in crisis now, but I'll see you in 4 weeks. And we want to meet people where they're at. Like, oh, you're in crisis, come on in, we will get you set up. And it's pretty amazing because we can even get you in to see a psychiatrist or that clinician right away. We can get a case manager or a therapist out to see you within a couple days because it's about prevention. It's not waiting until the crisis or till it gets too far along in the process. So how can we help you now?
That immediacy has been really lacking in, I think especially when you have a young person. And, you know, sometimes somebody will call me and they'll say, where can we get in today? And I think the ability to offer that brings to our community what?
Yeah. Well, we partner really well. So we had a couple years ago, we had a referral of a 4-year-old from Children's Hospital, and that kid was going to get kicked out of his daycare. The mom was going to lose her job, and you can think of all the other stressors that would have gone on. And the immediacy, we were able to get them in that day, get them to see the psychiatrist, and he was able to stay in school. Mom was able to keep her job, and we were able to relieve a huge stressor in their life.
So, final thought, what he really says is mental health, whether it's the child or anyone else, it's the whole family. Yeah, how do you tackle that?
It's the whole family, and it's the entire community. So we try to partner with everyone that we can, and I think just having a couple positive adults and role models and involving everyone in the treatment plan can make a difference for our entire community.
And I think what I hear you say is you're not helpless then as the parent. You're part of the process of healing.
Absolutely.
Yeah, excellent. Well, we're so glad to meet you, so glad to know a little bit more about the services. I saw you have multiple locations. Let's just share a little bit more about how to find you. New Path Child and Family Services, they have a phone number. As you said, if you call that, you can find out where you can walk in for that care. Yeah, thanks for being here today.
Thank you.
It's a pleasure to share your work. All right, just ahead, we are continuing this important conversation. They work with young people in area schools in some really unique ways. One of them is through the court system. I recently had a chance to explore that program. But Dr. Kim is in the house. So glad to have you here. She is the president and CEO of Central Clinic Behavioral Health. We are going to share more about what they do coming up on our Mental Health Town Hall. So grateful you are staying with us this half hour. Welcome back, everybody. We are usually what's happening in health. Inside that today, our Youth Mental Health Town Hall. And we are focusing this month on stopping the stigma, getting young people the right mental health resources they need. September, as you know, is Suicide Prevention Awareness Month. And as we continue to share resources in our community to save lives of young people, we have a whole host of resources in our community. They are sitting in our studio. Give me a quick wave there, everybody. We are welcoming them back this half hour. They will do everything possible to provide mental health care to those who need help. The team from Interact for Health we've had a chance to meet, the HAY program we call it, the Community Health Alliance, the Lindner Center of Hope, New Path Child and Family Solutions, but a few more are coming up. First, though, we do want to share with you some new research today. We're talking about this because research continues to show just how vulnerable young people are to mental health concerns. Study this week found especially loneliness. Haven't heard a lot about that lately, but researchers from the University of Cambridge found that after only a few hours without any social interaction, teenagers start to seek rewards that provide social reconnection, sometimes in unhealthy ways, alcohol, drugs. We also asked a few local students this week what other concerns drive mental health problems. Here's what one of them told us.
I think the number one leading factor for mental health issues is confidence, especially with body image, for the unrealistic standards that society creates for these beauty standards. That includes women and men too, but I know for women especially.
My goodness, they are so, when they say something like that, you know exactly what they're talking about, that you have this world wide web that just, wants you to conform to something that as a person you may or may not be. We want to introduce you to our team from Central Clinic Behavioral Health. Tell us about you.
Hi, my name is Kimberly Magis at Central Clinic Behavioral Health. I'm the president and CEO.
We love what you do because you have quite a diversity of services. I know you work in schools and whatnot, but recently I do want to talk a little bit about how you really try to intervene when young people get in trouble. Just tell me a little bit about that program.
We have a number of programs for youth, and when kids get in trouble, what we first need to do is listen. So it starts, we have some in the schools, we have some that do with very early childhood education. But in the schools with our Ready to Learn program, we are meeting with the kids in the school environment to try to help them. And then some of them then also come over to our Child and Family Treatment Center to get services there.
Excellent. And one of the places we know you serve, and sadly we're seeing more teenagers in it, is even in the court system.
Yes.
We have a little bit of video because I just kind of want to explain to people, someone meeting you right where you are in a place like that. Tell me about that.
Well, our court clinic program primarily focuses on adults, so our youth would be more in our treatment center. So
the young people that we met, I think, were in that. We're barely aging 18, 19, 20, 21. So I still see that as young. Maybe, maybe you don't see 12 to 17. But unfortunately, that often starts with a mental health concern, even younger, doesn't it?
Yes. So, when I think of youth, I think about younger, but, youth today is actually going into our early 20s. Right. So that program in particular serves youth that they can be as 18, and then if you get involved with the justice center system, that you can get treatment in lieu of conviction and start working on your mental health and possibly substance use issues as well.
No question that, what we saw is how you change lives. But what also that tells us is by the time they maybe got into the court system, like you said, you're starting in early childhood education. And sometimes throughout that, parents don't even know where to go for help. They know that they can see the problems evolving. So how do you reach them? What is it that you try to do to make sure to know they have resources?
So I think the most important thing is to listen. And so what we try to do is to talk about wellness, but looking at wellness as the total picture. It's not just health, physical health, it's mind, body, and spirit. And we begin by listening and normalizing some of the things that happen. Like when you heard earlier a youth talk about anxiety. Well, that is normal. Everyone feels anxious, right? So we need to be models for how do we handle anxiety. When we're nervous, sharing with our kids, this is what I do. This is how I feel better, and talking about it.
So how is that received when someone says, oh my goodness, anxiety is normal?
Sometimes it can be relieving and validating, and maybe kind of take the difficulty and just chop it down a little bit. I actually tell myself, it's just anxiety. And by not giving anxiety the power that it really has, by saying it's just anxiety, you're already starting to combat it because it's just anxiety. I can get through it.
Interesting. You know, I don't know that I've heard that, but you're right. Like when you say that, you're like, whoa. And I think we all look at that as, well, it may be just anxiety, but it can have a whole host of other things that come with it. And so being able to chip away. Yeah. Well, we have, as you say, followed your work for several years. It's a privilege to see you grow. We know that you have continued to serve in schools and whatnot, but if you would like to find out more about all of the programs, Central Clinic Behavioral Health, we have their main entrance, our main place at Albert Sabin Way, but they're kind of all over our community. 513-558-5857 is that phone number. We'll put all these details at what'shappeninginhealth.com. Such a pleasure to have you back with us. Stand by. We're going to go to our panel, and she'll be talking to us just a little bit more. We appreciate you.
All right. Thank you.
All right, just ahead, they provide both acute and outpatient care for young people. Juliana. Hey, my friend, how are you? So glad to have you here. She's the Director of Clinical Services at Glenwood Behavioral Health. We're going to meet her next on What's Happening in Health. Welcome back, everybody. So glad you're staying with us for our Youth and Mental Health Town Hall, part of our What's Happening in Health program today. And a young woman who helps provide both inpatient and outpatient care. We've had the privilege of following Glenwood Behavioral Health. Tell us a little bit about you.
Yes, my name is Juliana. I am the Director of Clinical Services at Glenwood Behavioral Health. Like you say, we offer inpatient and outpatient services to adolescents 13 to 17. As well as adults.
And you do, as I recall, a lot of the clinical programs. So talk to me about what that means.
So what that means is when they first come in, of course, they have to go through an assessment. And after the assessment, once they determine the level of care, whether it's inpatient or outpatient, we sit down with the patient and their parents or guardians to come up with a treatment plan. And once we come up with a treatment plan, we of course want to offer individualized care. So that's a lot of psychotherapy as we collaborate with the providers for medication management as well, so that we help to meet their therapy goals.
So I think if you're just watching us today, you may not realize the magnitude of this. You said just in the weeks where we're back in school, you're seeing an uptick. Tell me about that.
Yes, just last night we had a lot of admissions overnight. So we have seen an increase in admissions since the schools opened back up, which is a month ago. And for the most part, they present to our hospital with suicidal ideations, homicidal ideations, aggressive behaviors, but also just inactive psychosis.
Wow, and we have a little video of you, but let's talk about that, because that means that parent is really in crisis. When you are worried your child will take your own life, what do you do?
Right, and I like, as we talk about breaking the stigma, I like that a lot of parents are now allowing their kids, the people that they take care of, to seek help, and they actually bring them to the hospital for treatment. So we all know that when you treat an adolescent, there's no way you cannot engage the family. So from day one, we are partnering with the families to come up with a good treatment plan and to come up with a good discharge plan so that they can continue working on those issues for after they discharge from our hospital.
So one of the things that we often hear in news stories is that a parent did know about a mental health problem and they couldn't get them to stay in treatment, or they couldn't get them to the right person. So talk to me about that. How do you just continue to support that child so they get to where they need to go?
Yes, so if we have situations where the adolescents come to our program and the parents, because there's not that education about mental health, they want to pull them from the program. We still do what we are supposed to do as a hospital, refer them to outpatient providers so that they are still able to get the help that they need.
You know, I think that's so important. If you can incorporate their recovery with everyday life as they transition, which I know has been a focus, you really do teach them coping mechanisms that are different.
Correct. So we use evidence-based treatments like cognitive behavioral therapy, dialectical behavioral therapy, which mostly focuses on being able to identify some of those negative thoughts and how they affect our feelings and how that affects our behaviors. And we try to teach them coping skills to kind of like disrupt that negative, vicious cycle that is caused by, just negative thoughts and being unable to cope with daily stressors.
And couldn't we all benefit from some of that? You know, just interrupting that
Right.
downward spiral that often puts you in a place that is unhealthy.
Correct.
Yeah. Well, we want to make sure you know, I know you have a 24-hour hotline, but they have a number that you can call where you can actually talk to a human. They're located in Coleraine, Kipling Avenue. Want to make sure you know all the information will be at what'shappeninginhealth.com. Stand by, because we're going to continue this with our group. You've had a chance to meet many of these resources now. Our panel coming up next. They're going to share thoughts about stopping mental health stigma and much more in our community. Stay with us. Welcome back, everyone. You're watching our Local 12 Town Hall. We are focusing on youth and mental health today. St. Ursula Academy has a Mental Health Alliance Club, and it allows students to support each other. Here's what one of those student leaders told us about that this week.
So one thing that I've noticed is a lot of academic stress, especially when it comes to your later years as a high schooler. Things can kind of just like start coming at you and you may not be ready for it. So we try and help students out through those times, especially if they're struggling with that stress.
All right, well, we know who to ask about that. What stresses you out, my friend?
Many things. I think I can agree with the school stress. I think that is a huge contributing factor, especially for many youth as they age, especially when you get to my age in graduate school. But I do think that also just the contributing factors, whether that be your relationships, expectations that you put on yourself, your family, your friends, all of those things I think contribute to stress, and I think we all feel those.
Interesting. Pass that to Delaney, but I know, Delaney, he says we put stress on ourselves, don't we?
We do. We do.
What stresses you out?
I would say there's a lot of things that go into what stresses me out. One of them being school, but also like socially, there's a lot of social stress. Just feeling like there's a certain way that you have to show up to places, or just thinking about what other people may be thinking about you can also be very stressful on top of the school and you already trying to succeed and thinking about what people are thinking about what you're doing in school.
Boy, that's so true. All right, hand that to Godspeed. You know, you guys have a program. We're here because we're talking about the HEY program with this wonderful group. And you've learned, if someone says that to you, to share a few things with them. What do you tell them?
I always tell them to take some time off alone to collect themselves, maybe hang out with friends so they can apply themselves better when they're going back to school, so they're not as stressed or like they're more locked in.
Yeah, boy, I think that's so true. Go ahead and hand the mic to her, but one of the things young people say they have is they're so busy, they have so many activities, they always feel that stress to perform, to show up, to be there. How do you work with that?
We really work with listening to their voice. Like, I mean, it's just so important for us as adults to listen to what the youth have to say, because they'll tell you. And they've redesigned the program, this next cohort, to even meet their schedules and to eliminate some of that stress. But we just really, really, really work hard. HEY is really about uplifting and keeping the youth at the center and not tokenizing them, because one of their biggest complaints or concerns that they bring up is that we get asked a lot about, we get interviewed and we'll get asked our opinion, but we don't see things implemented. So we're really trying to model that and be a co-creator with them.
Yeah, go ahead and hand that mic. What that says is we don't just listen to you, we hear you, because you really value what someone contributes. All right, part of our program today, Stopping the Stigma. What does that mean to you?
Stopping the stigma starts with the families. It means educating families on the importance of having honest conversations with their kids about their feelings, about their struggles, and taking that first step to get them the help that they need.
Yeah, no question. If you pass that mic, one of the other things that we're hearing throughout this hour is the importance of listening. How do you do that?
Starting small. You know, I think when you ask your family member how they're feeling, what do you typically get, right? It's, I'm fine. Well, fine to me stands for freaked out, insecure, neurotic, and emotional. And so it gives you a funny way to engage with your child about, like, are you feeling that gamut of emotions? And if so, let's talk about it.
Boy, that's so true. Dr. Tracy, you know, she said, learn how to listen, but then when you hear and you want to implement, how do you share that we're going to implement what you say? How do you communicate that?
I think it's observation plus conversation. So we start the conversation verbally, but we're also paying attention, because sometimes the behaviors are telling us more than the words do. And then we reflect back on what I'm seeing. Is this change in your behavior? And what I'm hearing you tell me make sure we're getting it right, first of all, and then we can offer up to partner with them to make things better.
Boy, that's so true. If you hand that to Dr. Magis, you know, you start even younger. Like, you can have that with an older child, but in the younger group, do you share that with a parent? What do you do?
You do share it with a parent, but also anyone in their circle, because it could be a neighbor, it could be a friend, it could be one of their friends. As you teach people to start listening, but then involve the youth in what am I going to do about it, right? So you help them build skills in figuring it out and talking about it, right? It's not me telling you, this is what I think you should do. What do you think you should do?
Yeah, no
and then
question.
talking about
no
that,
question. All right, that really is true, and that's sort of your theme. You go into a home, you listen, you find that out. Yeah. Tell me just a little bit about. She says, you know, you involve. It takes the whole family. How do you empower them?
Well, not just family. It takes the community, family, friends. It takes school. It takes everybody, and being willing to hear that and to have a support structure around it. You know, since COVID, we've learned to be alone. And we're not built for that. We need to have that family, that community around us to support us when we're having those, to ask the questions when we're having those rough times.
Yeah, all right, I'll give you the final word on what he said. What we learned in COVID is that loneliness is truly a medical condition or can lead to medical and physical health problems.
Absolutely. And I try to focus on that when we're in session. I very rarely, or hopefully not at all, use this is what I'm going to do or this is what you're going to do. It's very inclusive language. This is what we're going to work on or what are we struggling with to make sure it's always clear that this is a team approach. I'm in this with you and we're in this as a team.
Yeah, well said. All right, we need to take a quick break. Going to be back with our panel coming up shortly. Going to hear some final thoughts. You are not alone in this journey. Stay with us. We'll be right back. Before you go, we are in the process of just sharing a few important thoughts. If you are a person that may need mental health help or someone in your family does, want to make sure you know there are resources, and they share some important things. This panel here today has some final thoughts for you. I want to know your final thoughts on hope. One of the things you hear from young people is, I don't feel hopeful.
And I connect hope with connection. So my final thought of the day is check on your people. Check in with your athletes, with your students, with your peers. Make sure they're okay. Ask, is there anything you need? What are you looking forward to? What are you proud of? Just make sure you've got that check-in and connection with the people around you.
And if you give that to your colleague, one of the things we hear from that is, I don't have that traditional support system. I don't have maybe a family member, or I don't have a whole classroom that, you know, will talk about mental health. What do I do?
Well, I think it's important to create that. We need to find that support, and sometimes people don't even know that there are people out there. So how do I make sure that someone knows, hey, I'm there for you and all that? So we have to let other people know that we're there.
Kimberly, as I hear that, he says, you know, we need to let you know you have other people there. You do that in schools and different places. Where can I look for that?
You can look for that hope with everybody. See everybody as an opportunity to reach out and say, I need some help, because you never know. It could be a stranger on the street that you just say, I need some help, and they could do something. People in elevators, people, friends, teachers. It doesn't have to be a person in power, but also when you hear somebody reach out for help, act, right? Walk with that person to get the help that they need.
Boy, that is so true. If you hand that to Dr. Cummings, this is Suicide Awareness Month. We don't want to focus on that, but we do want to let people know, if you hear that or you're worried about someone, your best resource?
Your best resource of safety is of concern is reaching out to 988, as we've heard, 911, if that is the first number that comes to your mind, or your local emergency room departments. We don't want to delay if we have concern about safety.
And if you hand that, you know, I'm worried that if I tell someone my child might be at risk for this, the stigma then will follow me.
No, that's what helps people understand that this happens to everyone. And so if it's happening to everyone, then who can you reach out to? And so like Dr. Cummings said, 988 is an opportunity for you to reach out and say, I need help, and for them to be able to provide you those resources.
And Juliana, when they do that, you're going to validate those concerns, aren't you?
Yes, we are going to validate those concerns. We are not going to be judgmental, because that's one of the reasons why people struggle to get the help. We are going to be empathetic, and we are going to steer them in the right direction so that they get the help that they need.
And I'm wondering, with the HAY program, I bet that non-judgmental thing is a critical part of what you teach, is it not?
Yes, and so important that we've created a rubric for safe and trusted adults that the youth put together, and it's very helpful. It's personally helpful for me. I always go through and check, am I being a safe and trusted adult?
That is very, very true. All right, hand that back. We're in our final 30 seconds or so. Tell me, what do you do for your own mental health? What do you do to take care of you?
I take time off from like just society in general to just sit down, just listen to music, like sleep, talk to friends if I ever feel like I need to, and things like that.
All right, hand that to your colleague. What do you do to take care of you?
I like to nap. That's usually
That is so good.
That's my go-to. But really just being alone and connecting with myself and figuring out what I'm going through so I know what my next step is to improve it.
All right, hand that last thought.
For me, I have a furry friend named Polo, a dog, German Shepherd. Sometimes he does get on my nerves, but I love him to death, and he is a great companion.
Yeah, we should all be so blessed. We are so grateful today that you were hanging out with us and this wonderful team. Want to say thank you, guys. That was great. That was a wonderful town hall. Again, if you need to find any of these people, they are here for you. Give us a quick wave. We will be back same time next week, everybody. Until then, stay well and stay tuned.
This program was previously recorded.